can become more focused, and that's part of what our strategic planning is about. Identify the areas where we really feel we're unique and have capacity to provide key collective areas of action that those other organizations, if we work with them in those areas and they understand what we're all about, it'll help create those synergies. And collectively with our partners, we'll even be that much stronger. And so I really think that that's key moving forward. And I think the other challenge we have, and a perception that I've been told many times, what's happened to CMHA? They used to be so strong on the national and provincial front from a policy and planning perspective. We were out there on so many issues, but over many years, our role has diminished, and we need to be at not only mental health system and service planning tables, but health system planning tables, primary care reform. We need to be there. We need to be out there nationally and in provinces. And I know in certain divisions there are pockets of work. BC and primary care reform and mental health has been just fantastic, and there are other pockets like that. But we need to do this more as a collective and have some national influence as well. I think a number of factors have contributed to the challenges or the perceptions. One is that we don't have an updated, unified, national level strategic plan. That's contributed to us losing our focus and losing our relevance, and that's why we launched a strategic planning exercise. And I encourage you, I know the sessions yesterday went well. Please, if you didn't get to the session yesterday, try and go today. And we'll have a session on Friday as well, and we've had a number of ways for people to have input, and I'll speak to that in a few minutes. The other factor that's contributed to our challenges, and some of this is actually from discussions in 2009 at the Congress. I'm just going to take some fuel here. And at the Congress, we heard a lot about the fact that there's limited communication and engagement across the organization, all three levels, limited information sharing on programs and services and policies. We're not leveraging our strengths and our capacities, and in some cases we duplicate between our own family. We have to put in place some mechanisms to deal with that. And I know there was discussion in 2009 and the commitment to do that. And here we are in 2011, but I think the last year or so has been a bit of a transition, and we want to get through some of these key priorities like strategic planning, but we are going to work on those things. We haven't forgotten about the input from 2009. It was very important input. We need also to have an approved fund development strategy. We don't have that. There's a lot of issues with fundraising across a tri-level organization. The issues are there, we know them, but we've never really rolled up our sleeves, had discussions across those levels, and sorted out how do we move forward in this area. What is the approach? What's national on first four versus divisions versus branches? And so we are embarking on that as well. And from my perspective, fundraising is job one in this organization. We have to come up with additional resources. Without resources, we can't make the changes we need to make to be a stronger, unified CMHA. We can't put in place the mechanisms so we can coordinate across levels and share information on programs and be stronger in policy and so on. So that's a key area moving forward, and we'll be having some discussion at the National Board on Saturday about a high-level approach. And then hopefully, based on that, and it will be very high level, we'll then start to break it down into some of the very specific things that we have to work on, like how do we revenue share? How do we do prospect clearance across three levels of an organization? And so lots of work ahead in that area. The other two things that I think have contributed to some of our challenges is we have, like all not-for-profits in Canada, variable board development and renewal in terms of all levels of our organization to ensure that we have the appropriate skills and expertise on our boards, given changing landscape and given the need to do things differently moving forward. And I don't say that to be a criticism. I say that's a challenge for all not-for-profits, and we share in that challenge. It's an important thing for us to focus on moving forward. We've also had, I think, limited management and staff succession planning and recruitment, and very limited retention and renewal in terms of our people, in terms of staff, our key resource. We can have the greatest strategies, but if we don't support our people, our strategies don't have legs. And I think that's another key area for us to work on. Difficult for us to work on without resources, which is why fundraising has to be job one. I think CMHA has had a great beginning, and we're at a point where we're still in a great place. But I think we have to create a new endpoint, a new beginning for us. And I think, whoops, I think I've gone ahead here. And I think that we can build on our strengths to create that new beginning. We do need to change, and this is another quote from Dr. Hinks. He, in his day, was saying, organizations change with the times. We don't need to go back and start a new beginning. We've had, as I said, a very strong beginning, but I do think we've got to create a new ending. And we've got some unique capabilities and capacities. One is our history, our dedicated staff and volunteers across the country, the mental health consumer perspective, our focus on inclusion. As Dr. Hinks said in creating this organization, it's an organization for the people, by the people. It continues to be that, and we want to continue to have it be that. The framework for support, a document developed a number of years ago, refreshed a few years ago, is a pivotal piece of work, and one that I think underpins a lot of the work we do, but a document that I think we need to pull off the shelf and use more. It should be the underpinning of our policy work and our planning work across the system. We can do so much more with that incredible piece of history that CMHA has. I mentioned the Congress and the input we have there. And then despite our decrease in profile that I talked about earlier in position, there is still significant awareness of this organization across the country. We confuse people because we're always talking about our levels and, oh, that's such and such a division, or no, that's national, or whatever. I mean, the media and governments and the public, they don't care about how we're structured. They care about CMHA and how can we help, and what are our programs, and what is our take or position on changes in health system planning or policy, or more specifically, mental health planning and policy. And so we've got to work on that. But there is significant awareness. We have a strong brand. A couple of other capacities or unique capabilities is around our linkages in communities across this country. We are truly a national organization in mental health. And that makes us so unique compared to all of the other players in this field in the landscape that I talked about earlier. And we really need to make sure that we capitalize on that and build on that. That is one of our key strengths. Imagine the expertise and capacity in locations of CMHA, staff, management, volunteers, and boards across this country, and the synergy that we could create if we could just figure out how to work smarter, how to collaborate, how to share, and work together as one. The impact, I think, could be very, very significant. And so, as the national CEO, that's where I want to take us. And I hope that you all feel we need to do that. And it's not going to be an easy road, but I think an important thing to do. We we're far from through. Far, far from through. We want to stay in the game, and in order to stay in the game, we've got to adjust the plan. We are the successors of this organization. We're it. And I think I sit at my desk and I have a portrait of Dr. Hinks. He looks over my shoulder every day. So I feel a little pressure because I have to stand on all of your shoulders. And your CEOs and EDs of your branch and divisions stand on your shoulders. And we all stand on each other's shoulders. And together we are going to continue to move CMHA forward in the way that Dr. Hinks would have wanted us to. So that's what our strategic planning process is all about. And some of you got a glimpse of this yesterday. I'm not going to spend a lot of time on this, but I did think it was important to talk a little bit about our planning process to strengthen the organization and identify those areas for collective impact, things we can work on together while maintaining the important autonomy and flexibility to respond to local and regional needs. The plan that will come out the other end of all this process will obviously propose some refinements to our vision and mission and values. It'll help us identify those priority areas for nationwide collaboration and some of the related strategies to that, and really strengthen us as one organization. We want to have all of the family, all of CMHA support this plan. This is not a national office plan. This is all of our plan, and that's why it's key that you all have input and help shape our new vision moving forward. And the collaborations that I'm talking about won't all be led by national. They won't all roads won't lead to the national CEO. Different areas of capacity and expertise across the organization. Some of the areas will be led by other divisions or branches, but on behalf of the entire family. That's where I'd like to see us get. The plan obviously is going to incorporate the Congress results and be relevant to, I hope, all of CMHA. And again, we'll continue to allow for that local autonomy and flexibility. The process obviously has involved all levels of the organization. The National Board is the sponsor of this plan. They have to approve the plan at the end of the day, and we need to then try to solicit support from boards across the country. I've been leading the process in collaboration with the CEOs and EDs of the divisions. They are the sort of strategic planning advisory committee, and the board is also in the loop at various stages. And then we've set up, as you know, a number of processes to get input from across the country, from division and branch staff, management, as well as boards and volunteers. I'm going to talk a little bit about the results of the strategy workbook consultation, the sessions here at the conference, which again, please try to get to those. And there will be a further consultation over the next couple of months. A few highlights from the results of the strategy workbook consultation session. A lot of the results, I'm not going to get into the details, were rolled up and form what's in the strategic planning sessions that are happening at the conference that we want your input on. But some of the highlights from the survey, what's that show? There's a game show where they say, survey said? Family Feud. So survey said. There's a lot of recognition of and pride in our strengths and our unique potential. A lot of recognition for the need for differentiation and clarification of our mission and our core functions. Those 4 pillars that we currently use need to really clarify and create some focus there. A strong commitment to promoting mental health and supporting resilience and recovery from mental illness. And a lot of people pointed to the needs and opportunities in that area as well. And I was very pleased with this result because it validated how I've been feeling based on the perceptions and challenges that I just talked about. But a greater, great desire for collaboration across CMHA, for a stronger national CMHA, a stronger national voice, as long as we don't lose local flexibility and autonomy. And also, a lot of people indicated they were concerned about pressures with respect to the capacity and sustainability of CMHA across the country. And as I said earlier, to me, this is critical. We have a burning platform in this area. It's an urgent need. And then also, I was quite heartened to hear that there was a lot of support across CMHA for the kind of broad strategic planning exercise that we were going through. So I was really very pleased to see all of those results, and it validated that I think we're on the right track. And so thank you. And it also, I think, bodes well that you'll continue to be participating in the process moving forward. Now let's just take a few minutes, and I'm cognizant of the time here, to talk about the future CMHA. And I want to talk about future in terms of two pieces. One, CMHA, but secondly, the future of mental health in Canada. And then I also have a few other quick things to touch on. And I'd like to try and save a little time at the end because I have a couple of questions which I'd like your input on. So in terms of the future of CMHA, I think based on what we've received so far in terms of the consultations around strategic planning is that there's not going to be a major change in the what CMHA does. We're going to focus it and refine it and update language so we're more relevant and current, but I don't want anyone to think that we're going to be moving in a totally different direction. The what is not going to change substantially. We'll just be more focused in our mission and our functions and directions. Where we need to make significant change in CMHA is on the how we work as a national organization and how we can work smarter and in a more collaborative way while balancing autonomy and creating synergy.